And it's time for health news, and today we welcome our doctor on call, Dr. Ryan Stanton, an emergency physician with UK Healthcare. He checks in several times a month to answer your health questions that you can submit online in the health section of WTVQ.com. Thank you for being with us today.
Well, thank you for having me.
We have some interesting questions that have come into our website in the last week. This one comes from Randy, and he says that he went to the ER and the people that took the information asked about advanced directives. What does that mean, and how does it affect your care?
Well, advanced directives are basically just saying this is what I want you to do if I can't make the decisions on my own. So they're how your care would progress if you've lost the ability to make your own medical decisions. So like a will, the main one we consider here is resuscitation, which is if your heart were to stop or to stop breathing, what would we do as health professionals? Now, this is a very important conversation to have. Most people would think, well, of course, I want you to do everything. Well, in certain situations, that may not be the best plan. You may not want us to be doing CPR, putting the tubes down to help you breathe. And it's a conversation that you need to have, that needs to be laid out. The paperwork needs to be available. So if you go to the ER, to the hospital, that we know, your family knows exactly what that plan is. And your family has to know, because it becomes a very difficult situation when we're there in the ER and the family is there. It's a very emotional situation of what our next step is and how far we go. Of course, if we don't know, we will do everything and anything we can, but that's important information to discuss with your family.
Great advice. Now, another question, I'm also talking about some of the information that's available to you and the physicians in the emergency room or at the hospital. This is from Connie, who says when you listen to talk radio, it sounds like hospitals treat people differently because of different things like insurance, their ability to pay, being an organ donor. How do you decide if that determines the course of care?
Well, this is a very interesting topic, because just earlier this month, a study came out from Harvard that discussed this and said people who don't have insurance or can't pay get worse care. Now, I can tell you for a fact, 100%, that that's not the case here in the ERs in Lexington. And why do I know that? Because I have no idea if you're insured or not. We don't find that out. The doctors don't know. The nurses don't know. So you get 100% care 100% of the time, no matter your ability to pay. It'll be interesting to see how this study kind of plays out as to why those rates of death and complications are different between people's ability to pay. But I assure you, when you come to the ER, you're going to get the best care we can provide. And we don't treat differently based on if you're an organ donor. We encourage people to do that. There's thousands and millions of people out there that need organs. And so it's very important, and I think a great thing to do, to be an organ donor and to make those wishes known. But we do not treat you differently. We do everything we can to save you. And if in the worst case scenario we're not going to be able to save you, then we turn to the idea of organ donation.
Well, we've got a lot of ER questions, and of course, you know that very, very well since you are in the emergency department. Another question that came up, this one coming from Julie, how many of the patients do you see in the ER that are really emergencies?
Well, that's a little bit of a hard question to answer, because it's your level of emergency. To us, that emergency is, you have to get pretty high because we're so used to seeing so many things. But a study from the American College of Emergency Physicians found that only 12% of people that come to the ER are not emergencies, those things that can wait. But we have many things that aren't life or death like you see on the TV shows. Most cases aren't those. But they only found that 12% of people truly don't have emergencies, so we're serving our purpose there in the emergency room.
Great. And just kind of a reminder that evaluate whether or not you can see your regular physician, do an after-hours clinic, or one of those things.
Exactly.
And keep the ER open for those really, really who need it. Well, if you have a question, you can submit those online in the health section of WTVQ.com, and we'll check back in with Dr. Stanton again. Great questions. Thank you for sending them.